Welcome to From Help to Care, brought to you by Family Health Center. I'm joined today by Brittany and Dr. Stankowski, Rachel Stankowski, to talk a little bit about Family Health Center, the Rent Ready program, and the Hope Consortium, and how all of that is built to support folks in recovery from alcohol or drug addiction, and how we really foster recovery and being successful in that. So, Rachel, I think you were going to kick us off with a little bit of information about Family Health Center, the Hope Consortium, the Rent Ready program, and so I'll turn it over to you.
Yeah, thanks, Eva. So Family Health Center is a federally qualified health center that started serving patients in 1974. So one of the things that makes us unique compared to other health systems is that we have a community majority board. So people from the community, patients that live here, and people that work here tell us what they want and what they need, and that's what we try to do. So we have two halves to our mission. One is to provide access to high quality health care services for the underserved. And underserved here can mean you maybe don't have insurance, you have less insurance than maybe is ideal, or you live in an area that doesn't have a lot of health care. And to meet that need, we provide access to dental care, primary medical care, as well as substance use disorder treatment services and a variety of enabling services like pharmacy, for example. Part of our mission also is to enhance the health of our community. So that's kind of the second half, and the half that's less obvious when you walk through a clinic door. But one of the ways that we do that is through the Hope Consortium, which is a collaborative network that formed in 2015 of really agencies from all across central, northern, and western Wisconsin that are interested in substance use disorder prevention, treatment, recovery, and harm reduction. One of those agencies being our partner, Three Bridges Recovery, right here in Wood County in Wisconsin Rapids. They're a really important partner to us, especially in that recovery space, but they do support all of those different pieces. So our partners, as we work together, we talk a lot about how do we get people into treatment? How do we help them in their recovery? And early on, people started talking about how important basic needs were. So people need access to food, to clothing, to education, to housing is another big one. And so as those issues were raised, all of us in the field of healthcare are thinking, well, what can we do about it? It's hard for us as traditional healthcare providers to think, what are we going to do to make sure somebody has access to food or to housing when that's generally outside of our wheelhouse?
Right. Yeah, healthcare is definitely starting to shift and look outside of the four walls of the clinic building, which is good because health and healthcare is influenced 90%, the research shows, by what's going on in your life outside of coming in and seeing your provider. And that is actually the start of the community health center movement, where a prescription was written back in the day when health centers were started for food. And it was just recognized, if you're going to treat this child who has malnutrition, what's the prescription for that?
It's
food.
Right.
We don't have food banks in health centers or in clinics typically, and that is the roots of health centers. So it's wonderful work that we're able to do at Family Health Center, and that second half of our mission, enhancing the health of our communities, is really the exciting and fun part of working at Family Health Center. So I'm glad you brought that up, because that's one piece that has kept me here as long as I've been. So Brittany, I think you have some perspective on why housing is something that we really need to address when it comes to recovery, and I'm wondering if you could share a bit about that.
Yeah, so to me, housing is important in a multitude of ways. If somebody doesn't have a safe, sober place to stay, they generally end up right where they tried leaving, and it's probably not the best environment for them. So a lot of times people can wind up going right back to the behavior that they were trying to get away from. So I think that the safe housing and being able to get into something is really important for one, the success rate of staying in recovery, and two, kind of feeling like you're getting somewhere and fulfilling this end goal.
Wow. So something that we all take for granted, or many people take for granted, sounds like it really can be a key towards recovery and maintaining that.
Yeah, for sure, especially when a lot of times it's the one thing that people have a struggle with, maybe they have a year clean and they've got a job and they have their license back in a vehicle and they're getting their kids back, but the only thing that's keeping them from getting their kids back full time is having a place to stay. That's their own.
Right.
Yeah.
Wow. I have chills. I mean, it's a great program to really have a huge impact. So we recognize that was an issue, an important piece for folks in recovery. So where did Rent Ready come from?
Yeah, Rent Ready is the true definition of a community designed program that really focused on what the recovery community said that they needed. So, we're all sitting around the table as part of the HOPE Consortium talking about housing. Everybody feels unable to address it. And I mean, I have to admit, when we started talking about writing a grant for housing, I was feeling panicky. Like, we can't, there's a reason that this is still a problem because it's hard to address. So, we started thinking about, well, what could we do? We as a health center, us as a consortium, we couldn't stand up a recovery house. That wasn't something that we had the funds, the expertise, or whatever to do. So we started looking at where could we make a difference? And we noticed that there was really this transition. So Brittany talked about how people will be in transitional living and they're kind of stuck there. Maybe they have an eviction history, maybe they have a criminal record, but if you're a landlord and you get to decide between these two applicants, you're not going to pick the person who has an eviction history. You're not going to pick the person with a criminal record, even if that person is now in a completely different position in their life. But if you have an option, you're going to go with the one who doesn't have those things. And so the rental market is really competitive, and we heard over and over again from people that do work in transitional living facilities like the Oxford houses in Wisconsin Rapids, or maybe the Hannah Center here in Marshfield, that people who were doing incredibly well were feeling discouraged. I'm doing everything I was supposed to do, and now I'm stuck. And I can't move forward. Maybe I can't get my kids back because places like the Oxford House, for example, amazing transitional facility, but it doesn't allow kids and families, for good reason. However, now this person's ready, they're in a good position, we want to reunite that family. So we started thinking about, well, what can we do about that piece? And so really, how do we get people into independent housing? And our neighbors in Portage County actually have a program called the Rent Ready program of Portage County. They work in partnership with one of their homelessness coalitions there, as well as the Salvation Army, and they developed this program that basically works to support people in that transition to independent housing by providing a rental guarantee to the landlords. So you do this training with the individual, help them to make sure they're a really good renter, they're a good candidate, and then you say to the landlord, we can vouch for this person. If they aren't able to complete their lease, we will pay 3 months of their rent, and you're not out anything, because in 3 months you'll be able to rent it again. So it's kind of a win-win for both sides, and we launched that program in 2022 in February of that month. People started applying, they got into the program, and then by June we had placed our first person. So the program has been incredible since then, and it's been really an enjoyable program to watch. We've changed things along the way, learned what works and what doesn't, and it's just been going really well since that time.
So where do the grant funds come from?
Right, so it originally started with federal funding from the Health Resources and Services Administration. They have a program called the Rural Communities Opioid Response Program. So we started with funding from them, so some pilot funding to kind of get that up and running. A big part of the program is being able to pay for services like those that Brittany provides through Three Bridges Recovery, then also having that rental guarantee, which is kind of a different one for grants, because usually you say, I'm going to need this money, and then you hope to spend it. We're kind of hoping we don't spend it, because the more people that don't end up leaving their lease early, we don't have to pay out for those. So we end up having some grant money left over. When that grant ended, we transitioned to using funding from the Roots and Wings Foundation. So it's a philanthropic funder that provides funds that support the program, and then we're also hoping to launch community support drives. So looking to places that are focused on housing. A lot of times churches, for example, might provide different elements of that, so home care supplies or clothing or food. So we're wondering if we might be able to talk to churches and other sponsors in the community to basically support people in this housing situation.
Okay, all right. So Brittany, how did you hear about the program to begin with? And then I keep hearing Three Bridges Recovery, so I want to ask you about that, but in a minute. But how did you hear about the program?
So I actually heard about the program from somebody when I was at a mutual support group. So the cool thing about recovery is you get to be with people that you once used with, So we were both kind of talking about the struggle of figuring out like how we're gonna find a place to rent. And someone piped up and they're like, actually, there's this Rent Ready program that helps people find places to live when they have evictions or felonies, or like I personally have maintaining a drug trafficking on my record, and no one likes renting to someone that has that on there, you know. So I was like, okay, well, how do I get hooked up with that? And then it just kind of went from there, and that's how I met Wayne, who used to be a part of the Rent Ready program, and met Rachel and Mel and all that. And so just kind of people are talking about it.
Word of mouth.
Yeah.
Shared within the groups that you're exposed to.
Yes.
Yeah. Okay. Well, very good. So we don't do this alone, Family Health Center. We need many different partners. And so tell me about the different partners that maybe are kind of non-traditional partners when it comes to healthcare.
Right.
We're a health center, but we're partnering with quite a variety, I think.
Like, it's definitely many hands make light work, and it takes all of us. Everybody kind of brings their own expertise. So we're there to facilitate the meetings. We can write the grants and help bring in the dollars, then do administrative aspects. But when it comes to actually serving the people in the program, that's where our partners come in. So Three Bridges Recovery, and I'll let Brittany share more about what they do specifically, but they are our peer support provider. And so individuals have access to peer support as soon as they are accepted into the program. They have access to support from Three Bridges. Brittany's like a genius at helping people to get through the Rent Smart process, work on a rental portfolio, get their budget prepared and ready. Once they're then in housing, then they have access to Three Bridges support for an entire year, that a whole year of their lease. And then, Three Bridges is amazing in that they work with people even beyond that, but it's just not through the program any longer. We also work with the University of Wisconsin Division of Extension. They have an amazing program called the Rent Smart program. So I know it's kind of Rent Ready, Rent Smart, but Rent Smart is available to anyone in the community, and it actually has two sides. One is for tenants, one is for landlords, and it basically just helps you to be the best renter you can be. What are your rights as a renter? What are your responsibilities as a renter? And the same for landlords as well. So those courses are offered through the extensions in every county in the state of Wisconsin. A lot of them are available online, and so they've been a tremendous partner. Jackie Caratini, who's recently deceased now, but she was an instrumental partner in getting the entire program up and running. She brought Rent Smart and the idea of Rent Ready to our consortium in the first place. So it was really amazing to work with them. We also work with some really incredible local landlords, people who are like, well, yeah, I mean, if this person's in recovery and their life is different now, we want to give them a chance. We've even had landlords that went from being just a landlord in the program to saying, hey, what do you think about me renting to this person month to month until they complete your program? So like that was one of the landlord's ideas, and she then started referring people to the program. So she's renting month to month to individuals
before they finish
the program. And once they finish it, she works on a year-long lease with them, which is really neat. And then we have a couple of different faith-based organizations that we work with. Love Inc. out of Southwood County. They do a lot of the furnishing for different homes and things like that. And then the St. Vincent de Paul here in Marshfield, they're wonderful. We are able to give people a voucher, and they can go in and get whatever it is they need for their home. So everybody gets, their pots and pans and, the things that, kind of add up when, you move in. And But like I said, the recovery community is everything to this program, and it's really Three Bridges that makes the entire thing work, and that peer support that's just, it's integral. They helped us design the program. I think if you don't have people in recovery at the table, you're not going to do it the best way, So people in recovery at Three Bridges were able to tell us this is what the program should look like, and now they deliver then that peer support, which is, like I said, just integral to the program.
Okay, now we're ready to hear about Three Bridges. Not only their interaction with Rent Ready, but really interested in the whole picture there. I think that it's a best kept secret, probably, and something that we really should promote out in the community. So you're on.
So Three Bridges is a nonprofit RCO, so it's a nonprofit recovery community organization.
Okay.
I believe it was 2019 that it kind of started up. So what we do is we hire only people that have lived experience in substance use disorder. So it's recovery coaches and peer support specialists. We have a couple parent peer support specialists now, but we just do our best to support people in the community however they need us. We believe in all pathways to recovery. So, harm reduction being a really big one. and we meet people in the jails. We do inside out smart programming. We actually just started a bunch of smart recovery meetings that people are really liking. Yeah, and if there's somebody that's in the emergency room that's experiencing an overdose or maybe detoxing from alcohol, we go in and we meet with them, like a very vulnerable moment where they maybe feel like nobody's there for them. So we go in and let them know, like, hey, we're here. If you need us, if you're not ready for us, that's fine. But there's really no prerequisite for working with us. It's, if mental health, the peer support specialists more work with the mental health part, but, we really focus on the recovery journey for people because it's scary and it's hard to navigate. And if people don't, when you go to therapists and stuff like that, they can understand to a certain extent, but really people who have been through it are the best ones to relate to.
Yeah.
So, yeah.
So what does it cost?
Nothing. Nothing at all. Our services are completely free.
Mm-hmm. And how is the organization then supported? How do you hire folks that have that lived experience? How do you function? And
well, we get paid through grants. I don't know too much about that because that's not my forte. That's our awesome fearless leader, Liz. She worries about that stuff, and our awesome office manager, Jenna. But I'm sorry, what did you ask me again?
Well, grants, you mentioned how you're funded, and I'm just curious, are there ways folks could give to Three Bridges Recovery?
Yeah, we take donations for sure. You can always go onto our website. I think we have a PayPal link. Mm-hmm. But we do a lot of outsourcing and resourcing, and if anybody's interested in just donating, they're able to do that. We also have clothing that people can purchase, and the proceeds go to Three Bridges.
Huh.
Yeah.
Okay.
If you're looking to do one of those birthday fundraisers on Facebook, you can do it to Three Bridges Recovery right there. So they've tried to make it easy to give.
Yeah.
Sure.
Yep.
Sure. What if somebody wants to get involved? Volunteer or be a peer supports person?
So if someone wants to become a recovery coach, like I said, the biggest part of it is you have to have lived experience. So this is the first time I've ever had that, suffering from substance use disorder at one point in my life was what
positive.
I needed.
Right, yeah.
So they have to be somebody in recovery. It can be from alcohol, from substances, whatever that looks like for them. But we just require a year clean or sober before you take the C-card training, which is the training that we use for our recovery coaches.
Okay.
We do post it. I think we have 4 a year usually, and we post them on our website for anyone who is interested in doing the training. And just because you do the training doesn't mean that you have to get a job at Three Bridges. Sometimes it's just cool to do the training because it helps you kind of understand the different pathways to recovery. Because even for me, I'm a 12-stepper. That's what saved my life, and that's what I go by. But I do support all the other pathways, but there was a lot of things I didn't even know about. And if it weren't for the recovery training, I probably would still not know about it. Mm-hmm. You know what I mean? Yeah. So, just getting that year of clean time and getting that training done.
And a lot of people do the training too that are just working with people in recovery. So the harm reduction specialists that work at counties, I know from Portage County, she just took the training.
Yeah.
There's some jail sergeants that have taken it, so they can better work with people in the jail. So it's a really cool training that Three Bridges offers. And they're the only ones that offer it locally.
Yes.
Mm-hmm. Okay. Very good. Thank you. So, how does Rent Ready work? How do we navigate through all those steps?
So Rent Ready right now is specific to folks that live or want to live in Wood and Clark County. So sometimes people aren't aware of what county they live in, but that would be, Wisconsin Rapids, Marshfield, Nakusa, Port Edwards, and then in Clark County, Neillsville, Abbotsford, Colby. So, people that live in those areas or desire to live in those areas can participate in the program. You have to have at least 6 months of sustained sobriety. So that is something that came directly from the recovery community, that this isn't a housing right now program. This is a long-term step into independent housing. So somebody who has that 6 months in recovery can then apply. They do have to have sufficient income to afford the rent. So this is not a rental assistance program like you might hear of through like HUD or other housing agencies. So we provide funding for that first month of rent and security deposit, and then the rental guarantee. Otherwise, the lease is in that individual's name with the landlord directly, and so they are responsible for paying the rent and any other expenses like utilities and things that aren't included. So once a person applies to the program, we have applications available online or through your recovery coaches at Three Bridges. Once somebody applies, they do an interview process. The interview has one person from our program who just kind of represents the program, but really the important folks that are in the program are people with lived experience in recovery. So it's somebody from Three Bridges as well as somebody from the Wisconsin Association of Sober Housing. So they sit in on that interview, they talk with the person about the program. Once they're accepted, then it's their job to complete these requirements, always in partnership with a recovery coach. Like I said, they do have that support during that time. So they have to complete that Rent Smart training. They have to complete a rental portfolio, which is basically like what Brittany talked about, those things that are in your past. You're right up front with it and say, this is what my rental history looks like. Here's where I'm at now and why it's different. And then a budget. So they have to complete a budget that shows I can't afford this apartment or this house. The other thing that they do is they work with their recovery coach to create a recovery wellness plan. And like Brittany said, it's any pathway to recovery, whatever that looks like for the person, and we don't have any oversight on that. That's just something between the coach and the participant to say, how are you taking care of your recovery and yourself? So once that person completes all the requirements, we can help them find a suitable housing arrangement. We work with our partner landlords who've been amazing, although we are always open to new landlords, and we've had a lot recently that are like, this sounds kind of neat. We'd be happy to do it. And I feel like once we get one person placed with that landlord and they see that this is a great program,
snowballs.
It does. It really does. So then the peer support continues during that year-long lease, and our hope is that they'll complete that year-long lease. If they're unable to complete that lease for any reason, whether that's because they're evicted or they choose to leave, we did have one individual, for example, who got a new job, and so she left her lease early to move closer to that job. I mean, that's a success, right? But we will still pay out that rental guarantee to the landlord, so the 3 months of rent to that landlord. So then once they're done with the year, it's take your rental history and do something good with it, right? So a lot of people choose to re-up with that landlord, or they might move into a different place, but now they have that positive rental history, a good referral from a landlord, and they can kind of move on into that independence without any kind of programming to support them unless they really want it.
Sure. You mentioned Clark County, so I'm just thinking, how do folks get to support from Rapids if they're living, even on the other side of Clark County?
They put miles on, a lot of miles.
Oh.
Yeah, because Three Bridges, we support multiple counties. I think we're up to like 7 or something like that now.
Wow.
Yeah, and Clark County being one of them. We actually go into the jail at Clark County and do programming there.
Okay.
So we never turn anybody down, but also like the awesome thing about Three Bridges that's happened is we've grown immensely. So we have coaches stationed in different counties.
Little outposts.
Yeah, exactly. Like we have marathon coaches, and a lot of the marathon coaches will do Marathon, Langlade, and Portage, and then the Wood County coaches will do like Wood County, Clark County, and Portage County. We even just got an Adams County coach. Yeah, so we're there for anybody.
So your home base is Rapids, but you've got people all over the place.
Yeah.
At a moment's notice, they can.
Yep. Our home base is Rapids and Anago. We have 2 offices. Yeah.
Oh, yeah, learning something.
They've grown so much in the last couple of years.
Wow. We really have, even since I've been there.
Sure. Great. So tell us what it was like to be a participant of the program and what it's meant for your life. And we don't have any Kleenex at the table, and we should maybe.
Maybe not. I don't know, but
well, for me,
it was life-changing. Like we had talked about in the beginning, I was doing a lot of the right things. I had finally figured out like recovery is something that I needed in order to live. Period. I have 2 kids, and I'd gotten to the point where I couldn't have them anymore, not because CPS was involved, but because I just couldn't take care of them, and I didn't have a safe environment for them. So when I finally was ready to find recovery, I was living at my mom's house. And while I am so grateful and appreciative of that, and my mom and my dad are amazing, we couldn't fit my family and her whole family in there. So when my year was coming up, because I did have a deadline, you know, not necessarily like my mom was like, you need to get out at 1 year, but like school was starting and things were getting complicated. So I had that deadline, and I had not a very good rental history. You know, I did have an eviction on there, and I had the maintaining the drug trafficking, which is not cool. So, and you can see that I was rated. Nobody likes that. So I was trying my best to find like private renters, and I don't have a credit. I didn't have very good credit, so I'm working on that now, but no one was gonna rent to me like through, you know, like Candlewood Properties or anything like that. So I was trying my best to find private renters, like driving around and just finding phone numbers. And I had finally found one that was almost gonna rent to me, but the person that had applied before me, they finally got their references back. So I was back to square one, and I was feeling, like Rachel was saying, super discouraged. Like, I had a job, I was getting good money, I was ready to support my family and like move on with this next step. And then thankfully, someone at the mutual support group I was at brought up Rent Ready. So I jumped on that right away. I was at like 9 months clean, and the Rent Smart class was amazing. It taught me a lot of stuff that I like didn't know, and like rights that I have.
And where would we find that out? They don't teach that in school.
Right.
They don't.
Anything.
For real, yeah. So like that was really eye-opening. And I mean, even like basic stuff like bringing a light bulb with me to make sure that the outlets and stuff work, and like bringing a charger and stuff like that, you know. And also just how to be a good tenant to someone who is letting me stay in their home, you know, like this is not my place, this is theirs, this is an honor to do this, you know. So when I finally was able to go through the interview and do the budget, and they were able to place me somewhere, it was the best. And I like did my best to not take that for granted. So it like solidified the last step of what I felt like was going to keep my recovery journey going. And I couldn't have done it without Rent Ready for real. And now I have both my kids and a dog.
Awesome.
And I just signed my 2nd year lease with the place that Rent Ready found me. So
very good.
Yep.
How can folks find out more about the program?
So that is really through hopeconsortium.org. So if you go to our website, hopeconsortium.org, there's a programs tab, and you just drop down to Rent Ready. Right there, there's the application, there's kind of the fact sheets, everything you need to know is available online. So you can even apply right online through a survey. You just click the link, fill it in, and it goes right to us. So yeah, easy to apply, and then we hook you up with someone like Brittany.
And honestly, people are like talking about it like crazy, you know, so you really don't need to advertise it too much.
Yeah. Brittany's our #1 referral source.
Awesome. Well, thank you for sharing this information. Pretty important stuff, and a gap in folks' recovery. And we'll enjoy sharing this with everybody else. So.